The Center for Individualized Medicine, Story by Story, a video series on topics in individualized medicine at Mayo Clinic.
Today we're going to go story by story with Dr. Linnea Baudhuin in the Stabile building talking about next generation sequencing. There she is. Dr. Baudhuin, tell me about what is next generation sequencing.
Next generation sequencing, or NGS, is a really great technology that we have today. It's been used clinically now for about 5 to 7 years, but before that it was a research tool. And it's really great because compared to previous genetic analysis technologies, it allows us to more comprehensively and efficiently look at genetic data. NGS is also a really key tool to the Precision Medicine Initiative that President Obama announced in 2015. So without NGS, we really wouldn't be able to move into precision medicine as rapidly and effectively as we are now.
So tell me today, you mentioned that it's used clinically. What are some of the most relevant uses of next generation sequencing today that patients might recognize?
Well, it really depends on the scenario. So for example, a lot of what NGS is used for today is for inherited disorders. So if a patient has a strong family history and some features of an inherited disorder that has known genetic involvement and that there's a gene panel available for, the physician may recommend testing. They also might recommend, for example, for a pediatric patient who has been gone through a lot of testing already and has a rare disorder that they can't quite pinpoint what's going on, they might do something like whole exome sequencing, and this is what we call diagnostic odyssey. And then the other major application for next-gen sequencing is for some cancer patients have certain types of cancer that are next-generation sequencing is really useful for helping to properly diagnose the cancer and determine proper treatment and possibly prognosis.
And is that where you see the future going of NGS? Like if you look 5 years from now or a couple years from now, are things changing? What do you hope NGS can help with in the future?
As we're gaining more knowledge about different genes that are involved and different variants involved in cancer, we'll be able to provide even better tests. Also, we see NGS moving towards the area of the microbiome, so helping to determine what bacteria or virus a patient has, and that's really important for infectious disease. Also in the area of pharmacogenetics and individualizing therapies. So there's a lot of different up-and-coming uses for NGS.
Okay, great. Well, I'm going to take off. My floor's coming up. Thank you so much for chatting with me. Have a good day.
Thanks, you too.
The Center for Individualized Medicine, Story by Story, Mayo Clinic's elevator ride through patient care, education, and research.